what should you do if you notice bleeding in the first trimester? Well, firstly, try not to panic. Do take it seriously. If your bleeding is light and you're otherwise well, the first thing you should do is call your GP or your midwife or a local early pregnancy unit. If it's out of hours when this happens, so it's nighttime or it's on the weekend, then you can usually wait until they open up, and they'll often arrange for you an appointment or a scan to check on what's going on. Now, if the bleeding is heavy, or you have severe tummy pain, you have shoulder tip pain, you feel faint or unwell, then you should go straight to A&E or call 999, because these could be signs of miscarriage that need urgent treatment, or of an ectopic pregnancy that could be rupturing. These do need urgent care. So, in short, you don't need to go to hospital for every single spot of blood in early pregnancy, but if you're worried, if the bleeding continues, if your symptoms get worse, you should absolutely get checked. One of the most common questions I get from friends and family is when this happens and it's 7 p.m. on a Saturday night, your instinct is to head straight to hospital to get some answers. So the question I get is, should I go to A&E right now? Well, there's a lot of misconception about what can actually be done for you in A&E. The truth is, if you're having a miscarriage, sadly, it's not a process that can be stopped or prevented. So attending hospital is not going to save the pregnancy. What we can do if you come into hospital is to give you some answers about what might be happening. If that pregnancy is indeed continuing, we can tell you if the pregnancy is in the right place or if it's an ectopic. What you want is answers, and A&E is not usually the best place to get those answers, as the scan that you want will most likely be done during working hours. So what we do in hospital is usually we start with blood tests. We check that you haven't become overly anemic, so you're in need of a blood transfusion. We might check your hormone level, and we might check your blood group. We also do basic observations like blood pressure and check your heart rate. We may examine you from down below to look at your cervix, see if there's any reason you might have bleeding or if there's any pregnancy tissue stuck inside the cervix. Now, the other thing you'd want if you're in A&E is a scan, but usually if that's going to be done in A&E, it may only be what we call a bedside scan, not of high quality. And it's just there to look and see if there's any free fluid in the abdomen, not to see exactly where the pregnancy is and if it's ongoing. The detailed transvaginal scans are not usually available 24/7. So if you are indeed having a miscarriage with very heavy bleeding or you have an ectopic pregnancy, hospital is the best place for you to get the treatment that you need. However, if your bleeding is light, your symptoms are mild, then you might be better waiting and speaking directly to primary care or to an early pregnancy unit or a doctor who's able to scan you. An ultrasound scan will usually be arranged, and that can check properly the position and the size of the pregnancy. Sometimes, especially very early on, the scan can be inconclusive, and in that case you might be asked to come back in about a week or so for a repeat scan, because pregnancies grow quickly and they can become clearer over time.